Hi, Todd Harmer, CTV News. Premier, I was hoping you would comment on the ailing healthcare system. The latest examples being an elderly island man who desperately needed a prescription filled, and also, who took out an ad in the newspaper for a doctor to fill that prescription, and now a Sioux family, military family, who says they moved from Winnipeg and could easily access care for their children there, and are now struggling to get any care here.
Well, certainly we have significant challenges in our healthcare system coming out of the global pandemic. Many people delayed a visit to a healthcare center, primary care center, during the pandemic. More and more people are coming out to access services that they were deferring because of stay-at-home orders and other challenges. That's put an extraordinary strain on what is already an extremely strained workforce. Why we need to create this institution is to create more spaces. I was at Camosun College last week, 2 weeks ago, recently. I apologize if time blurs for me these days, but I was speaking to nurses, licensed practical nurses, registered nurse students, anxious to get into the workforce. And I can tell you with absolute certainty that those that are in the front lines, whether they're in acute care or primary care, are desperate for those replacements and those new troops to come and relieve the burden. But it's not just a BC problem, and it's happening across the country. You will know that I had the premiers from all across the country here just a few weeks ago, and our number one ask of the federal government was, if we have a national health care program governed by the Canada Health Act, we need an equal partner to make sure we have sustainable funding and we don't find ourselves poaching the more prosperous provinces, of which British Columbia is one, poaching healthcare workers from other jurisdictions who might not be able to pay the premium to have those workers in communities. So we need a national plan. It's been pretty clear. It's not just me. It's conservative premiers, liberal premiers. It's not a question of perspective. It's a question of necessity. And the examples of having to put out an ad to get a prescription filled, or other families concerned about being able to access primary care, is a real and pressing problem. And we're doing everything we can to address it, but it needs to be across the country, not just across the community. And as we have families coming from around the country to British Columbia, they're not bringing the services with them. They're asking for them when they arrive, as they should. And we need to make sure that we have a national plan to deal with that. And that's not yet fully emerged. I'm confident the Prime Minister gets it. I'm hopeful we'll have some progress before the summer is done.
Do you have a follow-up?
What kind of follow-up do you plan if you don't hear from the Prime Minister?
Maybe I'll take out an ad in the paper. I don't know. I suspect we're going to do that anyway. But I've been pretty candid with the federal government about this, as have my colleagues. Again, this isn't a question of partisanship. It's not a question of a region. It's the whole country. You can talk to the Premier of Prince Edward Island, which is a population less than half of the Capital Regional District, has the same challenges that we have here. Winnipeg is an urban center, but rural Manitoba is having significant challenges recruiting and retaining skilled healthcare workers as well. But I want two parts to this. First of all, the patients have to be front and center. We understand that. We're in negotiations at the highest level with the doctors of BC. The Deputy Minister of Health has been engaged almost daily for the past number of weeks. I'm advised that the discussions are going well as we find a new formula to meet the changing circumstances that doctors, GPs, find themselves in. We have, as I think it was Ravi said, or Anne said, more people under 15 in this region than any other part of the country, but we also have more doctors over 75 than any other part of the country. So we have a significant challenge, and we need to start training more people. And this didn't happen last year, 5 years ago. It's been building for decades, and now we have to pay the piper. We have to find a way to make the spaces in post-secondary institutions to train these workers to provide these services.
We're going to go to the phone lines now. Richard Sussman, Global News.
Premier, to continue that conversation on healthcare, you make a joke about putting an ad in the paper. Is it acceptable to think that the fact is that there are British Columbians here that feel the only way they can access our system is by taking an ad out in the paper? You say this is a Canadian problem. You look at the wait times for clinics. We are double the national average, the longest in the country. And now we're hearing from 911 operators, and I know this is larger than just the healthcare system, but they're saying they're severely underfunded and can't take enough calls that are needed. So on all of those issues, can you speak to the specifics that you are managing with now? And is it acceptable that people are taking these ads out?
Well, firstly, the data that you referred to is several months old. It was one source, and I'm advised that the source missed out a whole bunch of variables in terms of wait times for accessing primary care services. We have been putting in place urgent primary care centers as a stopgap to prevent emergency rooms from being overrun. We have to make sure that we have the trained personnel in the urgent primary care centers. I think there's 24 of them now across the country, where there were none, or across the province. There were none 5 years ago. So that relieves pressure. But we're hearing, again, it's not just in British Columbia. I saw a news piece this morning before I came to the event today. Premier Doug Ford in Ontario is seeing unprecedented numbers of ERs being closed because they don't have sufficient staff to operate. This is not a BC problem, it's a national problem, and it's something that we all have to address together. With respect to the ad in the paper, the good news is that the family has found the prescription that they require. I would suggest that there are a whole bunch of other families that are scrambling to try and find access to primary care using whatever means they have at their disposal, friends and family. That's usually how these things happen. But the challenge is a personnel challenge. We don't have enough people, and you can't change that in a weekend. You need to change that over time.